Hello everyone, this is Dr. Shweta with Corona Trust working in Masao PHC as a medical officer. Today I'll be talking on the topic of healthy aging. Healthy aging is not as contradictory as it sounds. There are many changes, cosmetic changes, fitness levels, diseases like hypertension, diabetes, uh, not feeling up to it, fatigue, and all these are taken for granted, and these are considered as inevitable, but I tell you these are not inevitable and they can be prevented or delayed. There are many healthy old people and they are able to achieve highest level of fitness level, and all this is possible with dietary proper diet and exercise. Before I tell you how you can achieve a healthy aging, I'll tell you why and what occurs as the age progresses so that you can understand by yourself how awfully simple it is to manage your age, manage your body and mind as age progresses. So, as we age, there is something called sarcopenia that sets in. Sarcopenia is loss of muscle strength, loss of muscle mass, and loss in quality of the muscle. So, there is like after 30 years of age, for every 10 years, for every decade, there is 3 to 8% loss of muscle mass, and the strength of muscle is lost at much greater rate, that is up to 30% of strength is lost for every 10 years, and this is accelerated by hospitalization if you are immobilized for some reason, by your sedentary lifestyle and nutrient deficient diet. For every 1 week of continuous bed rest, if younger people lose 150 gram of lean muscle mass, old people lose up to 600 gram of lean muscle mass. And why do older people lose more muscle mass during hospitalization? It is because they are already losing muscles due to their age, and there are hormonal changes, that is increased cortisol, and there is increased rate of inflammation set by the disease, the sickness. So I'll list some the changes that occurs with age, and then I'll tell you how you can prevent them. One of the changes at the cellular level is there is increased fat infiltrated within your muscles, and fat do not give you any strength or power, and there is increased loss of muscle fibers, there is increased breakdown of muscle fibers, and this both leads to increased breakdown of protein within the body. And there are changes that occurs due to your lifestyle. There is increased protein intake through your food by you because of maybe reduced appetite, reduced or impairment of smell or taste, and there may be dental or teeth problems, and there are psychological changes like depression or loneliness, and these again leads to increased breakdown of protein. So because of this, the amino acids absorption and utilization is also changed, altered. So all these changes that I have enumerated, so you can see it yourself, these are preventable. So if there is increased breakdown of muscle fibers, you can compensate it with increased exercises, changes in your exercise routine. If there is increased uh, uh, protein breakdown or there is reduced absorption of protein, you can compensate it, you can beat it yourself by consuming more protein than you used to consume during your younger age. What helped you during 20s will not help you during 30s or 40s or 50s. You have to make changes according to your body and according to your needs. And so all the inevitable changes, the so called inevitable ailments that are considered and taken for granted by old people are preventable, and you can look so much younger there for your age with just a balanced nutrient dense diet, increase protein intake in your diet, and by weight training, by cardiovascular exercises. There should be at least muscle strength training exercises should be done for at least 2 to 3 days per week by old people. And the diet after exercise is also very important. If you are consuming 20 gram of protein after exercise when you are in your 20s, as you age you should consume up to 30 or 40 gram of protein after exercise. And protein intake is very crucial, is important point to maintain your health as you age. The fat and carbs should be balanced, but the protein needs to be consumed through your seafood or poultry, or if you are vegetarian you can take protein whey powder. So for young adults, 0.8 gram per kg body weight per day is the protein daily requirement. But as you age, due to optimize the muscle loss, to up to 1.2 gram of protein per kg of body weight per day is required, and this protein should be divided in all your diets. If you are consuming 4 diets, divide the RDA of the protein into your each diet. No diet should go without a protein constitute in the food. And you should also supplement yourself with vitamin B6, vitamin D, calcium. This can be through food ingredients or through multivitamin tablets.